The health and the well-being of society is really one of the most complex, pressing challenges across the world.
Historically, universities have focused on fundamental research in biology and chemistry and medicine. But I think that has changed some, and we have a growing footprint in technology development, like biosensors and bioelectronics, that are really accelerating the pace of new solutions.
So it's not only about the discoveries, it's making sure that those discoveries have the most impact and make the most difference in people's lives.
For a lot of applications, we really need a quantitative answer, not just a yes-no answer.
An example of that is for epilepsy patients. There are over 30 drugs, and finding the right dosage can be a challenge. So what we'd like to do is change this process by bringing technology to the patient. Let them use these devices to take real-time measurements correlated with how they're feeling, and then use this data to come up with a drug dosing plan that's going to be optimal for them.
There are 10,000 different rare diseases and 3 to 6% of the world's population. So that's 300 million in the world.
It can be a very confusing journey to get information about a rare disease.
So if we can design a system that decreases the time to diagnosis, imagine how much good we can do.
We're aiming to use artificial intelligence that can answer questions about rare diseases.
So if a researcher has a question, they can just post the question to Radiant, and then Radiant will give them a response in which they can follow up with and see our sources.
The quality of our air, the hazards in our built environment, all of those things have a profound impact on human health and well-being.
The U.S. is moving in the wrong direction. Our maternal mortality rates are rising, where the rest of the world are trying to bring those rates down.
The harmful algal bloom threatens to derail decades of progress towards making the lower Willamette River this equitable, freely available resource for the city.
When you do measure people's exposures to chemicals, it's really important that you let them know what you found and interpret that in a way that translates the information so that it is accessible.
I'm inspired by the degree to which our students are wanting to leave this world better than they found it.
We hope that what we build could be a model in terms of bringing technology to patients, empowering them to be part of their own healthcare.
It's really about helping support people through the decision-making process when they are confronted by risk.
Taking all of these amazing advances that we have had in technology, and hopefully to solve those problems much more rapidly.
We're going to make a difference in people's lives. You can't beat that.